Blood is essential for life, responsible for transporting oxygen, nutrients, hormones, and waste products throughout the body. It consists of red blood cells, RBCS, white blood cells, WBCS, platelets, and plasma. Disruptions in any of these components can lead to a range of blood disorders, each with unique symptoms, causes, and treatments. Red blood cell disorders. Red blood cells carry oxygen via hemoglobin. Common RBC disorders include anemia, a condition marked by a deficiency of RBCs or hemoglobin, leading to fatigue, weakness, and shortness of breath. Types include iron deficiency anemia, sickle cell anemia, a genetic disorder causing misshapen RBCs, and pernicious anemia, caused by vitamin B12 deficiency. Polycythemia, VERA, overproduction of RBCs, making blood thicker and increasing the risk of clots. White blood cell disorders. WBCs are crucial for immune defense. Abnormalities include leukemia, a cancer of the blood and bone marrow leading to excessive production of abnormal WBCs. Lymphoma, a type of cancer affecting lymphocytes, a type of WBC. Leukopenia, a low WBC count, often caused by infections, autoimmune diseases, or chemotherapy. Platelet disorders. Platelets help blood clot. Key disorders include thrombocytopenia, low platelet count, which can result in excessive bleeding. Causes include bone marrow issues, autoimmune conditions, or certain medications. Thrombocythemia, excessive platelet production, increasing clot risks and leading to strokes or heart attacks. Plasma disorders. Plasma carries proteins involved in blood clotting and immune responses. Disorders include hemophilia, a genetic disorder where clotting proteins are deficient, leading to prolonged bleeding. Von Willebrand disease, a milder clotting disorder caused by a deficiency in von Willebrand factor. Hypercoagulable states, conditions like deep vein thrombosis, DVT, and pulmonary embolism, PE, arise when the blood clots too easily. Other notable blood conditions. Thalassemia, a genetic disorder causing abnormal hemoglobin production leading to anemia. Myelodysplastic syndromes, MDS, a group of disorders caused by poorly functioning blood-forming cells in the bone marrow. Septicemia, also known as blood poisoning, it occurs when a severe infection spreads into the bloodstream. Blood disorders vary widely in their nature and impact, from mild to life-threatening. Early diagnosis and advancements in treatment, such as medications, transfusions, or bone marrow transplants, have improved outcomes for many patients. Understanding and managing these conditions is vital for maintaining overall health. Multiple myeloma is a type of blood cancer that arises from plasma cells, which are a type of white blood cell responsible for producing antibodies. Under normal circumstances, plasma cells play a crucial role in the immune system by helping the body fight infections. However, in multiple myeloma, these cells grow uncontrollably, accumulate in the bone marrow, and interfere with the production of healthy blood cells. The excessive proliferation of abnormal plasma cells, known as myeloma cells, can lead to various complications, including weakened bones, kidney damage, anemia, and a compromised immune system. The diagnosis of multiple myeloma involves a combination of clinical evaluation, laboratory tests, imaging studies, and sometimes biopsy procedures. Patients often present with symptoms such as bone pain, fatigue, frequent infections, and unexplained weight loss. These symptoms prompt healthcare providers to investigate further. A key diagnostic tool is a blood test, which may reveal elevated levels of calcium, anemia, or abnormal kidney function, all potential indicators of multiple myeloma. Specific blood tests, such as serum protein electrophoresis, SPEP, and immunofixation electrophoresis, are used to detect abnormal monoclonal proteins, M proteins, produced by myeloma cells. In addition, a free light chain assay measures the levels of free light chains, which are another marker of the disease. Urine tests, particularly a 24-hour urine collection, may also detect the presence of Bence-Jones proteins, which are light chains excreted in the urine and are indicative of multiple myeloma. Bone marrow biopsy is a critical diagnostic step that involves extracting a small sample of bone marrow tissue to examine under a microscope. This test confirms the presence of myeloma cells and helps assess the extent of bone marrow involvement. Imaging studies such as X-rays, magnetic resonance imaging, MRI, computed tomography, CT scans, and positron emission tomography, PET scans, are utilized to identify bone damage or lesions caused by the disease. The presence of osteolytic lesions, areas of bone destruction, is a hallmark of multiple myeloma. To standardize diagnosis, the International Myeloma Working Group, IMWG, has established criteria that incorporate laboratory findings, imaging results, and clinical symptoms. These criteria include evidence of at least 10% clonal plasma cells in the bone marrow or the presence of a biopsy-proven plasmacytoma, along with related organ or tissue impairment, such as hypercalcemia, renal insufficiency, anemia, or bone lesions, often summarized as the CRAB criteria. Early diagnosis of multiple myeloma is critical for effective treatment and management. If diagnosed early, treatments such as chemotherapy, targeted therapy, immunotherapy, stem cell transplantation, and supportive care can improve outcomes and quality of life for patients. Multiple myeloma is a hematologic malignancy that disproportionately affects certain demographic groups in the United States. While the disease can occur in individuals of any age, race, or gender, epidemiological studies have identified notable patterns in its incidence and prevalence. Age is one of the most significant risk factors for multiple myeloma. The disease is primarily diagnosed in older adults, with the median age at diagnosis being around 69 years. Approximately 90% of cases occur in individuals over the age of 50, and it is rare in those under 40. This age-related trend is thought to result from cumulative genetic and environmental exposures, as well as age-related changes in the immune system and bone marrow environment. Racial disparities are also prominent in multiple myeloma incidents. African Americans are more than twice as likely to develop the disease compared to white Americans. This elevated risk has been attributed to both genetic and socioeconomic factors. For example, African Americans have a higher prevalence of monoclonal gammopathy of undetermined significance, MGUS, a precursor condition to multiple myeloma. However, differences in access to healthcare, diagnostic delays, and treatment disparities may also contribute to worse outcomes in this group. Gender differences are less pronounced but still notable. Men are slightly more likely to develop multiple myeloma than women, with a male-to-female ratio of approximately 1.4 to 1. The reasons for this disparity are not entirely understood, but may involve hormonal differences, occupational exposures, or genetic factors. Geographic and socioeconomic factors also play a role. Studies suggest that individuals living in areas with limited healthcare access or lower socioeconomic status may experience delayed diagnosis and reduced access to advanced treatments. Additionally, exposure to certain environmental toxins, such as pesticides or industrial chemicals, may increase the risk of developing the disease. Overall, the demographic most affected by multiple myeloma in the United States includes older African American men. Public health efforts to address these disparities should focus on increasing awareness, improving early detection through screening programs, and ensuring equitable access to high-quality treatment. Research into the underlying causes of these demographic differences remains critical for developing targeted prevention and treatment strategies. Living with a diagnosis of multiple myeloma presents numerous physical, emotional, and logistical challenges, but many people find ways to manage their condition and maintain a meaningful quality of life. Multiple myeloma is a chronic disease that typically requires long-term treatment and frequent monitoring, making adaptability and a strong support system essential. One of the first steps for individuals is understanding their diagnosis and treatment options. Collaborating closely with healthcare providers helps patients make informed decisions about therapies such as chemotherapy, immunotherapy, targeted therapy, or stem cell transplantation. Many patients find comfort in being proactive about their care, asking questions, and seeking second opinions when necessary. Educational resources, support groups, and counseling services can also empower patients and help them navigate their journey. Managing symptoms and side effects is a critical aspect of living with multiple myeloma. Patients often experience fatigue, bone pain, and reduced immunity, which can affect daily life. Medications, physical therapy, and lifestyle adjustments such as a balanced diet, regular exercise, and adequate rest can mitigate these challenges. Some individuals benefit from complementary therapies like acupuncture, yoga, or meditation to reduce stress and improve overall well-being. Mental health plays a significant role in coping with a chronic illness. Receiving a cancer diagnosis can be overwhelming, leading to feelings of fear, anxiety, or depression. Emotional support from family, friends, or mental health professionals is crucial. Many patients find solace in connecting with others who have multiple myeloma through support groups, whether in person or online. Sharing experiences and strategies for coping can reduce feelings of isolation and foster a sense of community. Financial and logistical considerations are also significant. Treatment costs, insurance navigation, and time off work can be burdensome. Social workers, patient advocacy organizations, and financial assistance programs are valuable resources for addressing these concerns. Planning ahead and organizing medical appointments, medications, and personal responsibilities can help patients maintain a sense of control. Finally, living with multiple myeloma often reshapes a person's outlook on life. Many individuals reflect on their priorities and find ways to focus on what matters most, whether that's spending time with loved ones, pursuing hobbies, or achieving personal goals. Embracing a mindset of resilience and hope, while acknowledging the ups and downs of their journey, helps many people live fulfilling lives despite the challenges of their diagnosis. As we wrap up this comprehensive look at multiple myeloma, we want to take a moment to thank you for watching and engaging with this important topic. Whether you're a patient, a caregiver, or someone simply seeking to learn more about this condition, your time and attention are truly appreciated. We hope this video has been informative and empowering, providing you with valuable insights into the diagnosis, treatment options, and the experiences of living with multiple myeloma. Remember, education and awareness are key in the fight against this disease, and your support helps spread this message even further. If you found this video helpful, please give it a thumbs up to let us know. Your likes not only motivate us to continue creating quality content, but also help this video reach others who might benefit from it. We'd love to hear your thoughts, questions, or personal experiences in the comments below. Your input helps build a community of support and shared knowledge. Don't forget to subscribe to our channel and turn on notifications so you never miss an update. We have more insightful content coming your way, covering various aspects of health, wellness, and other important topics. Sharing this video with your friends, family, or social networks is another great way to spread awareness and make a positive impact. Once again, thank you for joining us on this journey. Stay tuned for our next video, where we'll dive deeper into topics that matter to you. Until then, take care and stay informed.